of the YouTube live, case discussion, and your question answers. Yes, so please start your question answer session. Good afternoon, Dr. Sadhana. I think after a long time you have come. So, today I just wanted to discuss one of the cases of COVID-19, which we got very good results with the no-sort COVID-19. I'll discuss when everybody comes online. So, a question again was there on WhatsApp. So, I'll start answering that question first. Now, people have asked me this question before also. Give me the COVID-19 report. So, I have a COVID-19 report which was cured within about 3 days of treatment. So I'll share the reports and share the remedy also with you. So today somebody had asked me something about, good afternoon, Dr. Meera, Dr. Kocher, something about adenoids, adenoids. Now, I have told you something about adenoids in my lots in my previous webinar also, but there are some remedies which are very, very useful for adenoids. I would like to tell you some rare remedies which you should use in your practice, acute remedies that will give good result. That is, first is Sanguinaria nitricum is a very, very interesting remedy, a rare remedy, but very important. Second is it's a bowel nosode, that is Bacillus psychoticum. It's a psychotic compound. It is also very, very useful in case of adenoids. The third remedy that you should always think about is Sambucus nigra. And of course, then we have Calcarea, Naxomega, Lycopodium, Lemna minor, Agriphus nut, a lot of remedies. But these 2-3 remedies are rare but very important in case of adenoids, especially in children. And to tell you something about Sanguinary nitricum, again, it's a very rare remedy, rarely prescribed because I think the Mathematica is not so very well understood of Sanguinary nitricum. But a very important symptom of Sanguinary nitricum is that the nose feels absolutely obstructed. The secretions are very scanty and there's a lot of dryness, there's a lot of dryness. So if you are treating a case of sleep apnea, in that also Sanguinary nitricum is a very, very important symptom. It has an important symptom of dryness, obstruction feeling, and there is a post-nasal secretion adherent to the nasopharynx. That's a very, very important and interesting symptom of Sanguinary nitricum. So do use this remedy. It's a very interesting remedy. And in throat symptoms, I think the Sanguinary nitricum has a very dry and rough throat, the constricting feeling with burning. And in Sanguinary nitricum, the right tonsils is swollen. The right tonsils is swollen. So I welcome Dr. Alexandra, Dr. Parth, Dr. Poonam, Dr. Cherapulli, Dr. Bever, with Prakash Singh. Good afternoon. So this was something in related to Sanguinary nitricum. Of course, it has other symptoms also. If you have a very interesting symptom, a very interesting cough which I cured in case of COVID-19, where the patient suffered from tickling. He used to tell me, Doctor साहब कुछ तो भाई tickle होता है, ऐसे गुदगुदी होती है वहाँ पे. In that case, Sanguinary nitricum is a very, very interesting remedy which has tickling cough. And always in Sanguinary nitricum, the voice is altered, deep, and hoarse. So these are the very interesting symptoms and important symptoms of Sanguinary nitricum which I have seen in my practice, like in nose and throat, and it's a very, very important remedy for influenza and acute pharyngitis or acute or chronic catarrhal conditions. That's Sanguinary nitricum. I hope you understood something about the remedy. So let's go further. Good afternoon, Dr. Shazia. So let us go forward. So this is a case of COVID-19. See the RT-PCR report, which was positive. It is here, positive. And after three days after treatment, the report came to be negative in 3 days. Now there are lots of patients of COVID-19 of late which I have been able to treat and cure within a span of about 3 to 4 days. And let me tell you, I have used that COVID-19 nosode which I have prepared, and it has given me wonderful results. I have treated more than about 500 patients with the same nosode, and it has given me very good results. Okay, so normally what happens when the patient comes to us with the first report which is positive, and if he starts feeling better, he does not go for that other report because he feels he's okay. So a lot of cases where the COVID was positive, then it become negative, but the patient has not taken the report. In those cases also, COVID-19 nosode, which I have made, has worked wonderfully. Okay, good afternoon, Dr. Vishaka. So this was an interesting case, and that's why I wanted to share with you. Next, there was one more question where the patient came and there was a question of a doctor that whenever the patient inhales the air, मतलब जब भी वो सांस लेता है अंदर, तो उसको तकलीफ होती है. He feels uncomfortable, he feels itchy, he feels like sneezing, he feels like coughing. So the cold air is very sensitive to the patient. So he said that he has given remedies like arsenic, he has given remedies like Hiparsa, which is not working. So if the inspired, this is a very interesting symptom, that is when the patient has sensitive to inhaled air. So if this is the symptom, generalized remedy would be Hiparsulf is there. But I had told you a very, very important remedy in this condition where you have to use this remedy whenever there's a problem with cold air. Whenever the patient inhales cold air, he has problem of sneezing, irritation, XYZ, use the remedy Aurum triphyllum. So Hiparsulf, Aurum triphyllum, Antim crude, Merxol, these are very, very good remedies. Dr. Fazia, good afternoon. And I had told you some very, very interesting symptoms of Aurum triphyllum. Can anybody know that? Can anybody tell me the symptoms? Aurum triphyllum. Very, very important remedy. You have to use this remedy in your practice because this remedy is actually not used properly in our practice. Can anybody tell me some of the symptoms of Aurum triphyllum that you have to always note and always use this remedy and always have this symptom for prescription? What are those symptoms? Of course, I'll not tell you something written in Mater Medica, but whatever I have seen in my practice. Yes, I had told you before, Aurum triphyllum. Anybody? Can you answer my question? Aurum triphyllum. Nose, yes. Nose or lips picking. Okay. Anything more? Anything more? This is right. Anything more? Good afternoon, Dr. Shoaib. Anything more? See, whenever you want to prescribe Aurum triphyllum, one symptom has to be there. The coryza is most of the time acrid, fluent, and the nostrils are always raw. The patient touches and there is pain. And then you have discharges which are acrid, which are excoriating, which are euchorious, inside the nose, in the alienasi, on the upper lip, like arsenic and allium cepa. And that's why the patient has constant picking at the nose, constant until it bleeds. And a very, very irritating symptom, the patient comes and sits inside your chamber and does like this. Like this. This is Aurum triphyllum. There is boring of finger with the inside the nose. Don't always give Sina or Centonine or Chilone for worms. It is a very, very classical symptom of Aurum triphyllum. That is, the patient has boring of finger inside the nose and it looks very ugly. That is Aurum triphyllum. You understand? So do think about this symptom. Of course, then you have picking of the nose, then bleeding from the nose, and everything is there. But these 3-4 symptoms are very, very important of Aurum triphyllum. Of course, and then other symptoms which are other remedies which I told you is Hiparsulf, Merxol, Aurum triphyllum. Antim crude again is a very, very important remedy when the patient is sensitive to inhaled cold air. When the patient is sensitive to inhaled air, जब भी he takes breath, he has all the symptoms start, especially in the frontal sinus, zincum metallicum. So these symptoms are these remedies are very, very important when the patient is sensitive to inhaled air. I hope you understood something about that. Very, very interesting. Antim crude. So antim crude, see, if you see antim crude also very close remedy for like Hiparsulf, sensitive to cold, aggravation after taking cold bath. Whenever in summer the patient comes to you and he says, boss, there are a lot of coryza, sneezing and all, and he tells you that he has had a bath with cold water, do think about antim crude. Don't always think about arsenic. hip herself, because they are so very prescribed, sometimes abused. Think of antim crude. This is a very, very important symptom of antim crude. Aggravation or sensitive to cold air, and aggravation after taking cold bathing, cold food, cold drinks. In summers, we see there is a lot of scorching heat of the summer here in Nagpur. We go and drink some lemon water or take some ice cream or drink some cold water. You start getting sneezing and irritation. Think about antim crude. In fact, when the inhaled air is very sensitive, you have to think about horse chestnut also. About horse chestnut also, this remedy is also very, very important in this condition. Horse chestnut means et Aesculus hypocastinum. It is so much written in Aesculus hypocasticum that it is sensitive to cool inspired air, and that cold air causes burning and rawness and fluent coryza and sneezing. How many of you have given Aesculus apart from piles in nose complaints? Anybody? Good afternoon, Dr. Lisa, Dr. Madan. Yes. How many of you have thought of Aesculus in cases where the inspired air feels cold, there is fluent coryza and sneezing? Because when there's coryza, sneezing, cold, the first remedy that comes to our mind is arsenic. And how will you differentiate this Aesculus hypocastinum with other remedy for coryza? I'll discuss Romex also. In Aesculus, it is written that obstruction of nose or nose complaints due to hepatic disorder. So do think about Aesculus hypocasticum. Don't always prescribe arsenic herself. It is a very, very important remedy, especially in relation to hepatic disorders. So think about some remedies which you have not used because you have not seen the magic of those remedies. It's pure magic. When the remedy works, it's like pure magic. You give that dose and the patient comes and tells you that, sir, it's like magic. So this word magic, I'll tell you how I came to know. Just a minute. I'll just show you a WhatsApp. Of a patient. See what does he write. Just a minute. I'm just showing the symptoms. See what does the patient here tell us. Read this WhatsApp. Can you see the WhatsApp? Can everybody see the WhatsApp? Yes? He has written, sir, namaskar. It's a miracle. In third dose, I got relief first time in 60 years. First time in 60 years. Thanks. Should I take for 1 day more? See, if I tell you that I have cured this type of cases is something different. But when you understand, but when you see the report, I'll just show you again. It's beautiful to read, Just a minute. It is really beautiful. In 60 years, see what is written. This is how you have to actually see the remedy and then prescribe, I'll just tell you. See, now you can see. Sir, namaskar. It's a miracle. I have not felt this better since 60 years. 60 years. Can I repeat the dose again? So this is how the patient uses the word miracle. 1 dose of this remedy, difficult to see, but I'm just reading. If possible, I'll send you the WhatsApp also. In that, I'll just take out the name. But this is what we have to understand. If I can enlarge it, this only I can enlarge this much. I hope you can read this because some words basically are easier heard than you read. That's important. So in 60 years, thank you for your trust. So in 60 years, he felt better and had just given the remedy Aeschylus because he is suffering from recurrent cough, cold, coryza, recurrent cough, cold, coryza, stools problem, lateral problem. He had taken all the medicines possible on the earth. So I had just read the Materia Medica. It is to say to all the spectic people. Yeah. So I had written Materia Medica. I had heard and read Materia Medica Aeschylus. I just gave Aeschylus 203 doses. So he writes me, I'm better after 60 years and can I repeat the dose? I said, wait, don't repeat the dose. So this is how you have to understand and basically prescribe the remedy. The remedies which are, like for instance, Berberis vulgaris is such a remedy for stones, but there are other indications of Berberis, like Aeschylus for piles, Hemimelis for piles, but there are some symptoms of these remedies. You don't have to always prescribe rare remedies. People keep running to understand rare remedies, all remedies which are very common, but you know only the common symptoms of the remedy. Try to learn something what is not given in that remedy, then you will be a good prescriber. So one question was of Rumex. I'll tell you something about if the letter are verified. I'll send you on the WhatsApp. Okay, I'll cross the name and send you. So somebody asked me something about Rumex. So in Rumex, to understand one thing is very important. Like I told you, in Aurangaphylum there is mucus in the posterior nares. In Rumex, opposite is there. There is feeling of dryness in the posterior nares. That is the difference, the exact difference of Rumex and Aurangaphylum. And of course, it is there. Sneezing is there. Sneezing attack is there in Rumex. It is there. But in Rumex, this is very important. One thing of Rumex, always remember, this symptom has to be there. There is a sensation of lump, not ameliorated by hawking. It descends down and rises again after swallowing. It's like that. Patient is trying to put something down. I'll explain in Hindi. एक पेशेंट ने मुझे बताया था कि डॉक्टर साहब आप समझ लीजिए, एक छाछ का बर्तन है, उसमें बर्फ है, मैं चम्मच ले रहा हूं, बर्फ को नीचे डाल रहा हूं और बर्फ ऊपर आ रहा है, बर्फ को नीचे डाल रहा हूं, बर्फ ऊपर आ रहा है. फॉर द फॉरेनर्स, the patient described that it is like a bowl where there is lot of lassi in it or buttermilk and the ice is floating on top. I take a spoon, I press the ice inside but comes up. I press the ice inside, it comes up. This was a sensation in throat and I gave the patient Rumex. So this is interpretation. Now don't try to interpret that he is mentally very upset and the emotions cannot go down. He goes down with the emotion and comes back again. No, it is Rumex crispus. Lump not ameliorated by hawking descends down and rises up again after swallowing. Did you understand the meaning? Did you understand the difference of Rumex? Who had asked me the question? Understand. Rumex is such a common remedy, for this, but how the patient describes is so important, That is Rumex. And one of the very important symptoms of Rumex that I just remember, there was a lady who came to me that he told, Dr. Saab, I have a lot of rumbling and flatulence when I'm walking, and anytime it comes, if I eat healthy food also, if I drink water also, this keeps coming. And that is a very, very important symptom of Rumex, my dear friends. Don't always think about China, Lycopodium, Carbovage, Pulsatilla, Naxomica. No. Rumex, annoying rumbling flatulence in women. Close your eyes and give Rumex. Though it is not given in repertory, it is Materia Medica. Because we have studied only Rumex for cough symptoms and no symptoms. We have not studied Rumex in abdomen. And very, very important symptom of Rumex, which I have cured so many times in my practice, the patient has discharge of offensive flatus from the navel, from the umbilicus. That is Rumex crispus. Do you get me? Of course, you must have seen a lot of symptoms of Rumex of cough, cold, coryza, which I will not tell you. But these symptoms of Rumex, please write down in your Materia Medica. Please write down in Materia Medica. annoying rumbling flatulence in woman, offensive flatulence from the navel, and third symptom, do write down, Rumex patient suffers from sudden sleepiness. He says, I'm just working, and suddenly I fall asleep. That is Rumex. Whatever I can see clinically, what I've prescribed in my practice, I am sharing it with you. So this is something about Rumex. I hope you understood something about Rumex. So inhaled air, very sensitive. Think about Hiparsulf, think about mercury, Aesculus, Aurangaphylum, and Tim Crude. We have ranunculus bulbosus also. These are very, very interesting and important remedies for these complaints, because see, whenever cold comes, the only remedy that comes to your mind is Hiparsulf and arsenic. Do think about these remedies. Do think about Rumex. Do think about Aesculus. For my sake, next time a patient comes to you with cough, cold, coryza, sneezing, you think it is arsenic, but the patient tells you that I had jaundice in my life, I have a lot of digestion problem, bloating gas. Give that patient Aesculus and see the results, and then tell me how did you find the difference between Aesculus, arsenic, and Hiparsulf. Okay, so a lot of discussion on water medical. Let's have some questions from you. Reading is difficult. Okay, so any questions? So we have finished this COVID case, a fantastic case. And those of you have got my COVID-19 nosode, do try in your practice and just tell me how does it work. Okay. So if there are no questions, do we go for another question on the WhatsApp, or do you have some questions? See, live questions are always very important, because everybody gets to know, everybody gets to learn, Dr. Gupta, Dr. Alexandra, yeah, wonderful. Thank you, Dr. Ved Prakash Singh. इस बार ये नहीं आया क्या हमारा शिव प्रकाश सिंह? Which rubric would you first? Right knee RA pain. No, Dr. Chirapalli, right knee pain. Now, rheumatoid arthritis is basically a very common problem, and just if I would tell you the name, there are so many remedies. And what could I tell? Right from, if you start from A to Z, there will be so many remedies. But still, if you feel that you have a problem in the right knee, so do write down. There are few remedies which are very, very, what you call, precise to the right knee. You can write down remedies like, first remedy you must always think is what? Rustox. Do think about Rustox, because Rustox comes first. Then you can think about remedies like Ledampal is there, then calcareous carb is there, then benzoic acid is there, pulsatilla is there, kali iode is there, natramur is there. See, so just if your question is more specific, I'll be able to answer more specific thing. Then for right side, do think about rare remedies like verbascum, think like China, pulsatilla, tuberculinum, lycopodium, hydrastis, guaicum, gaultheria. So many remedies, for acute complaints and all. Arsenic personality, I'll come back to you. So Dr. Alexander has rubric. Which rubric would you think for a patient that shows no sensitivity towards the feeling of or others or people? Now again, if I tell you, Dr. Alexandra, if I tell you something about this rubric, so everybody will jump to one rubric, everybody will jump to one rubric. And what is that? Anybody? Everybody will jump to one rubric, He does not, everybody will jump to one rubric, Dr. Alexander, that is indifference. Okay, but now indifference has so many remedies. Okay? Anybody answer? Total lack. See, now Dr. Alexander has written total lack of sensitivity means he has no emotions. But if you have heard recent doctors telling something about Mater Medica, only one remedy will come to your mind. Is good. It goes beyond that. So one remedy will come to your mind, that is granite, which people say that he has totally indifference. It does not. If his mother has fallen, his father has fallen, he will not pick up the father also. No? He will not pick up the father also. But I have seen no result with granite in this condition. Dr. Alexandra, you have to go to Fatak Repertory. Phatak, see, understand this rubric is a fantastic rubric. Phatak has written indifferent stoic, S-T-O-I-C. Indifferent stoic. Stoic means beyond indifference. And there are two remedies. The first remedy is, what is the first remedy? I told you once. Anybody remembers? Stoic. The rubric is stoic, S-T-O-I-C. And the first remedy that I told you, you must remember that remedy. That remedy is called the tree of heaven. The tree of heaven. And the name of the remedy I'll tell you. I think Dr. Alexandra had told you a symptom of this remedy in relation to glands. And the remedy is Elianthus glandulosa. It is written in the Materia Medica. Stupor or stoic indifference with sign. That is Elianthus. And second remedy which Dr. Phatak refers is opium. Opium. All conditions with no sopor. Allen's keynote. If you have read Allen's keynote, opium. All conditions, he's written that. Open Allen's keynote and see opium. All you'll understand what I want to tell you. Want of susceptibility. That is opium. So these are the two remedies which are written in indifferent stoic. So these are the remedies which are above indifference, because if you see the rubric indifference, there are so many remedies. And beautifully Allen's has written, if anybody has Allen's keynote, you have to open Allen's keynote. I think it is the 4th or 5th line. All complaints with great sopor, S-O-P-O-R, painless, complains of nothing and wants nothing. That is opium. Understood? It's a very, very good question. A very, very good question. And I suppose a very, very good answer also. All complaints with great sopor, painlessness, complains of nothing and wants nothing. Do read something about opium. Okay. So severe muscle pain in right hip. What to give? There are so many. You can start with the basic remedy Macphos. Or you can give remedies like belly spur, or you can give remedies like Ruta. That will also work very nice. Thuja. It goes beyond Thuja. Good afternoon, Dr. Amit. Very dominant, needs to be in control all the time. Okay. So we understood something about opium and something about Elianthus. Elianthus, it is a remedy which is not used so frequently. But do read the Mathematics of Elianthus glandulosa, and you'll be surprised. These remedies are so rarely used, but it's a very, very important remedy, for throat complaints, and there's a lot of halitosis, a lot of fetor, and it is an important remedy for malignant conditions. That is Elianthus. Do read about this remedy, and then we can discuss this remedy next time. Okay. So let's go further. Some other question. Yes. Dr. George, right hip. There are so many remedies. You can start using first Macphos, as I told you. Think about Macphos, think about Rustox, think about belly spur. These remedies basically work for the muscle problem mostly. So can we very fast have some questions again? Thuja, if you see the Materia Medica, if you see the repertory of, as I told you, the answer from Dr. Phatak's repertory, I'll tell you something about Dr. Phatak's repertory in relation to Thuja. Dr. Phatak's repertory, there's a rubric called fanatism. And I think the only remedy there is of Thuja. Okay, he's a fanatic. That is Phatak repertory. Yeah, Dr. Lisa, only in women. You're absolutely right. I was talking about Rumex crispus. Okay, Yeah, Abhishek sir, vitamin D deficiency. Now see, there are lots and lots of patients when they come in your OPD and you tell them, okay, bhai, check your vitamin D, it is maximum times low. You know, so there is no problem of the sun in India, especially Nagpur. There's a scorching heat of the sun. It is a question of absorption. Vitamin D is there, but the absorption is not there. I have never seen something specific remedy for vitamin D, but I always ask the patient something about in relation to the nutrition of mind. Nutrition of mind which has been lost, and because of that, the problem of deficiency starts. It can be B12, it can be D3, it can be of any element or any amino acid. Nutrition. Now, problem of nutrition, you can get this rubric basically from the Fatak repertory. Nutrition of mind, I'm talking about. And if you open Fatak repertory, it is written nutrition affected. I think one of the Google Meet, I taught something about nutrition. Nutrition is affected in Fatak repertory, and the remedies there written is Brata carb, Calcarea carb, Calcarea phos, Nitrum mure, Silicia, which I can remember. But the nutrition is affected. So go in this cases by this angle, and you'll be able to definitely correct the deficiency, any deficiency in the patient. Salam, Dr. Rambi. So please share experience with treating lipoma. Let me tell you, lipoma, if you ask me also, first of all, I would not like to have the patient with lipoma because it is definitely very irritating. It takes a lot of time, and the results vary from person to person. I have not have, I would say, very good results for lipoma. I have some good results of lipoma. Some work very well, some do not work very well, but 50-50 I can say. And the remedies which basically I use, I told you in my previous webinars also, lapis alba, thiocinaminium, phytolica, conium. These remedies I use very frequently. Of course, then I use biochemic silicia 6x also sometimes. And then depending on the constitution, then I prescribe the remedy. Creatinine level 13 with hiccup, how to approach? If the creatinine level is 13, hiccup is taken as a normal symptom because there is a lot of bloating in the abdomen, there's a lot of water accumulation. If the creatinine is 13, my advice would be start dialysis at least twice a week. Let the patient settle down and gradually take the history. In acute conditions, you have to give the remedy what I give, L serum in L impotency. L serum in L impotency. It works wonderfully. Okay. Second, Dr. Amit, there is a remedy which is called as a homeopathic diuretic. Homeopathic diuretic. Does anybody know the remedy? Homeopathic diuretic. Anybody? Yes? It is homeopathic diuretic that you have to also think of. Solidago, yes. So very nice. It is a Solidago is a very homeopathic diuretic, and it also gives us very good results. Solidago, and I use Solidago basically in 12C potency. In 12C potency, of course, I have seen in cases of renal failures when the acute phase goes, it is very important to understand the whole constitution of the patient. Can anybody tell me one more remedy? Can anybody tell me one more remedy which will replace the work of catheter? Yes. Solidago, okay. One more remedy? Thuja? No. Which will replace the work of the catheter. If catheter is required to drain the urine is there, but catheter is required to drain the urine, that remedy works very nice. It works fantastically. I have so many times used. No, it is not Sabalsa Ruleta. It replaces the use of catheter. Apocyinum, no. Cantharis, no. Yes, Dr. Sadhna. Can we have something more? Causticum, no. Again, I would like to get your attention to some common remedies. Because if you read some uncommon symptoms of the common remedy, you'll be a better prescriber and you'll not be able to judge other rare remedies. So Dr. Nigavekar says Punarnava, that is Bohirvia diffusa. No. I like to get an attention to, no, not Prohireva. To those remedies which are very commonly used, you know all the symptoms of that remedy, but as you have not read some other system of that remedy, you are not able to get that remedy. I'll give you one hint. That remedy is used by all the doctors in most of the time in female complaints in related to menses. Now, can you guess the remedy? Keep on reading, keep on reading. If you don't read and keep on following those rare remedies, you will not be able to prescribe the remedies which are sepia, no, more than sepia. That remedy is basically for metorrhagia and menorrhagia. Remedy for metorrhagia and menorrhagia. So if we are telling something, the replacing the catheter, that means it has to be organ remedy, no? Organ remedy. No, not Macphos. We have been taught in a college life two things. If there is a lot of bleeding, and the blood is watery and the blood is clotted. For watery blood, that is trillium pendulum, and for blood mixed with clots, then you have to think about one remedy that is not Sabina, not Verbunum, not Pulsatilla, not Helonius. It is Thalaspi bursa pastoris. Thalaspi bursa Thalaspi, not Boista. So go home today and read Boric Matermedica. I exactly remember that line is written just above the relationship. Just above the relationship. One sentence written often replaces the use of the catheter. That is Thalaspi bursa pastoris. Do use this remedy for that complaint. It has a very, very good results. Thalaspi. That is so important. In Thalaspi, I remember a case where the patient came to me where the eyes and the face was totally puffed, puffed up face with white coating of tongue and the mouths and lips cracked. And I gave that patient Thalaspi 33 doses and everything was better. See, Thalaspi in head complaints. Puffiness of the eyes and face. There is white coating of tongue and the mouth and the lips are cracked. That is Thalaspi. But because we have been reading Thalaspi so much, so much for female complaints, we never think of that. In fact, if you get a case where the patient is suffering from chronic cystitis, he has taken lots of antibiotics and he does a sonography and the doctor says you're suffering from chronic cystitis and the size of the bladder has reduced because of chronic cystitis. Then also, my dear friend, the remedy is Thalaspi. It's a very, very important remedy for chronic cystitis, dysuria and spasmodic retention of urine. And there is accumulation of gravel stones in the urinary bladder. It has exactly the same symptom of Lycopodium, and that is brick dust sediment in urine. That is Thalaspi, I'll just share you one case, I'll just listen this case. Just listen this case and how did I get the answer right, The patient was suffering from stricture of urethra. Of course, he had taken treatment and nothing was working. In fact, I also treated my assistant. He went to them and they also gave some remedy and they did not have good results. So when the case came to me, I asked him, how is the urine? What did he explain me? The man told me, sir, जैसे हमारा, I'll tell you in English, पहले हिंदी में बताता हूँ, बोले जैसे हमारा सीमन कैसे निकलता है, डिस्चार्ज सेक्स के बाद निकलता है, धीरे धीरे निकलता है, जेट के समान, मतलब इंटरवल में निकलता है. He says, just as after sex the semen discharge, how the semen ejaculates in spots, that is my flow of urine. I have to strain, it comes then stops, it comes then stops, like the semen. It comes in jets. And I gave him Thalaspi bursa pastoris 200, and the patient was not better, cured with the remedy. You see the symptom in Thalaspi, it is written urethritis, urine runs away in little jets. And I cured a case of stricture urethra with Thalaspi. So this is how I'm telling you. Again, I'm just telling you something, that always read the symptoms of the remedies which have you been specific. Thalaspi, menses symptom, everybody knows. Urine symptom, nobody knows. Head symptom, nobody knows. So instead of, what you call, I can say, अपना दिमाग खर्च करने rare remedies पे, if you learn common remedies in total, no, automatically you'll be a better prescriber. Okay, I hope I could make some point clear with you. So we have a question from Dr. Robbins. Chronic diarrhea for almost 2 months. Fear has caused patient to take too many supplements. Podophyllum sulfur worked for 3 days each, then stopped. Now see, chronic diarrhea, first of all, if the patient is suffering from diarrhea and it is chronic, so you have to tell me, why did you get sulfur and podophyllum? Yeah, so only Dr. Alexander agrees of what I tell. Nobody agrees with that? So I hope everybody agrees with that. Read some uncommon symptom of the common remedy, you will be a good prescriber. So coming to chronic diarrhea. Whenever you have a chronic diarrhea, there are 3-4 remedies that should come to your mind, Dr. Robbins. And first remedy you have thought very much right, that is sulfur. But in chronic diarrhea, the first remedy that you should think, it is written in a Matermedica, that the remedy has often on since childhood, same, that is phosphorus. You have to remember phosphorus. Very, very important. First. Second remedy, that sulfur you already thought of. Third, argentum nitricum. Fourth, again a very, very important remedy, though you may think that it is rare, not used by everybody, but I have still got very, very interesting results with this remedy. Chronic diarrhea. Of course, Chaparro is there. Of course, Chaparro is definitely there. But that remedy, you'll be surprised at what I've used in my practice. And that is Calcarea carb. Then you have remedies arsenic, basilinum, cuprum ars, ferrum metallicum, graphitis, and lot of remedies. Podophyllum is also there. But think of phosphorus first. Second, you must think about argentum nitricum, sulfur. Then Calcarea, arsenic and all. Chaparro is also very interesting remedy, Chaparro is also good. And sometimes, Kurchi, again will give results. Kurchi and Igil marmilose, if you want to know something about the rare remedy. Okay. So as you go further, child starts getting running nose after taking barf ka gola 1 day back. So I just told you about from taking cold. So which remedy I told you from taking cold? First remedy that you should always think about from taking cold is, of course, Antim crude is there. But in this case, do think about Rustox, Hiparsulf, Dulcamara, Merxol, and arsenic. Very, very interesting remedy. Very, very interesting. Taking cold aggravates. You can think about camphor also. What are the most important remedy in your experience that the patient has sudden urge to stools, and if you don't run immediately, he has loose stools. Yeah. So in this case, the patient will come and tell you that whenever I have sudden urge, I feel that the anus is open and I have to go. If I don't go, the stools will come. Anus is open like a hydrant. Which remedy comes to your mind? Yes, anybody? Which remedy comes to your mind? Okay, there are a lot of questions, so I'll not ask. You must think about one remedy, and that is phosphorus. Phosphorus is a very, very important remedy. The patient feels that I have to go. Second remedy that we think about is croton tig. Third remedy, ozone. And the fourth remedy that you have to think is Aristolochia clematis. So these 4-5 remedies which I have found very useful. The patient basically has to go sudden urge. If it does not go, he has in the pants only. Chronic urticaria, of course, there are a long list of remedies. You can start thinking first. Urtica urens. Yes, antimcrude I told. Yeah, you can think about that also. So you can think about what was I talking the question? Urticaria. You can think about urtica urens, you can think about histamine, you can think about moxol, you have to think about phosphorus, you have to think about arsenic, you have to think about dulcamara, you have to think about bovista. All the remedies for chronic urticaria. But do think in urticaria, the defining symptom has to be there. You know, urticaria just by going the warm, coming from cold to warm or warm to cold, urticaria by eating something, from heat, but that is very important, because chronic urticaria will have hundreds of remedies. Aloes is there, but more of mucus. CPI is there. Okay. 6 months old child, atrophy. Yes. So, Dr. Dr. Ansari, I think last time I told you that you please WhatsApp me that case in detail so that we can also try. I can't guarantee, that I can cure that muscular dystrophy, but the lifespan is 2 years. So you do send me that on my WhatsApp. So if the whole case I understand, it's a case where you have to ask the symptom of the mother during pregnancy. That is important. If you ask those symptoms during pregnancy, the emotions, the journey of the whole pregnancy, then you will be able to understand the remedy and will be able to will be able to prescribe something. Okay. Hookworm. For hookworm, do think, Dr. Nabi, one remedy which I have found very useful and almost sometimes very specific, sometimes very specific, and that is thymol. THYMOL is a very, very good remedy. Thymol. Approaching is, as I told you, first of all, Dr. Faiza, take the history of the mother during pregnancy, what all emotions she went through during pregnancy, whatever medicines she took during pregnancy, and the hereditary history of disease in the family, his grandfather, grandmother, dada, dadi, nana, nani, and then something very specific in relation to the child. And that makes the whole history, because whatever he has got from the mother, from the fetus. So you have to ask the emotions from the mother side, and then you will be able to at least try and give some satisfactory results to the patient. So for hookworm, think about thymol. Think about, I think, Caradus mar is also a very good remedy for hookworm diseases. And one remedy which I have of late prescribed to a patient, that is carbon tetrachloride. Okay, so I don't use this remedy, copper, I don't know. Carbon tetrachloride, thymol, and Caradus mar. Okay. So let's again go further. Some more questions. Oh, it's already 3:55. I have a webinar now. So I think today's most of the questions have been answered. Still, we'll have one more question before we say goodbye to everybody. One more question. Anybody? 8-month-old child can't hold his head. How to approach? Okay, that was Dr. Amit. Yeah, if he is not able to, the milestones are late, so you have to understand, so you have to, in case taking, you have to see whether the milestones like walking, talking is also late. If it is late, then why it is late. You have to again go in these cases to the pregnancy history of the mother, the emotional setbacks, the trauma, the medications, the life situations of mother during pregnancy, and then you'll be able to do it. And some very striking feature of the child, childbirth कैसा था, डिलीवरी वैक्यूम थी, डिलीवरी सीजर थी, ask that. That's important. So last question we'll take from Dr. Sneha. Frozen shoulder. First of all, make sure that the frozen shoulder is not because of some primary conditions. Most of the time, we see that the frozen shoulder is because of diabetes, and the remedy should be, you have to think about right side sanguinaria, left side spigelia or calmia latifolia. Other remedy that you should think about is a very rare remedy which I have been using in now is iris versicularis. And second, you must think about, one remedy that is iodum. That also works wonderfully in case of frozen shoulder. Again, there are other few remedies that you should always know. First is ferrum metallicum. Second is rust toxicodendron. Third is ruta. Fourth is sanguinaria canadensis. And fifth remedy, which is again not rare but rarely prescribed, because there are a lot of adhesions, in frozen shoulder encapsulitis, adhesions. So you have to think about that remedy, and that is theocinaminium. Theocinaminium I have discussed at length in my YouTube channel. So go to my YouTube channel and see about theocinaminium. You will enjoy that remedy. Okay, you found it, Dr. Robbins. Thank you. डॉक्टर मिश्रा, आप तो आज सवाल एक भी नहीं पूछे, आपके बारे में हम वो बताने वाले थे, आप सवाल नहीं पूछे आज. Dr. Robbins, did you find thalassemia, bursa, pastoris in both the conditions? First, replace the work of catheter, and second, urethritis, urine flows in jets. Ferrum metallicum, yes, ferrum metallicum, Dr. Anup is right, ferrum metallicum is also there. So these are the remedies for frozen shoulder. So thank you everybody, thank you for your patient hearing, and it was nice talking and discussing with you. Thank you so much. Dr. Madan, next time I'll take the question, okay, because I'm rushing for a webinar, or you can WhatsApp me, I'll answer on the WhatsApp. Okay, thank you so much.